So what a root canal is, and it's a dreaded term by many, is that, in essence, a patient has a cavity or a long-standing filling, and the tooth now, or the nerve inside the tooth, I should say, starts getting inflamed, and it starts causing pain. So patients experience hot and cold sensitivity. Primarily, it hurts to chew on it. They're getting throbbing, or in some cases, if it's left, they start getting swelling because the nerve gets infected. So what a root canal in essence is very similar to a filling. When there's a hole in a tooth, we clean it out and we fill it. With a root canal, there's a nerve inside the tooth. So what we're doing in essence is we're just cleaning the inside portion of that tooth where the nerve sits, and then we're filling that. Again, as long as the tooth is well frozen, then these root canals are painless procedures. Generally, they range from about 40 minutes up to about a couple of hours, depending on the size of the tooth. So, for example, a smaller tooth in the front would take less time. A molar, which is at the back, would take more time because there's more roots. Once they're done, the great outcome is you get to keep your tooth. The downside is that it does make the tooth weaker because we've, in essence, almost hollowed out the tooth. And remember, the tooth is all there. No portion of the tooth gets removed with a root canal, but it is weaker. So for root canals, we always recommend something called a crown or a cap that goes over the tooth. A root canal and a crown go that intimately close together, and it's there so that the tooth can be protected so that it doesn't break in the future. And these root canals, if done properly and while frozen, are a very pleasant experience and allow one to keep their tooth for many years to come.